Today, I will be sharing some northern perspective to this topic. We in Oulu, we condense these operations with public-private innovation and healthcare innovation in the Oulu Health Labs, and that's in the core of the presentation. But I will also share some insights into our current Future Hospital 2030 project. But let's get started. So my name is Timo. I'm from Oulu University Hospital, and in the longer term, that is Wellbeing Services County of North Ostrobothnia. Very easy to know that. I have a career in innovation procurement. I used to work for Nokia for 10 years, but already more than 10 years I've been in the life science sector and been enjoying a lot. It's been a blast. I love bringing new health tech available to be utilized by healthcare professionals and provide the best possible care for the patients. Outside office hours, I'm in this Lykra. Many times I like to do endurance sports. I will come back to that how it's connected to healthcare also. And then I'm also doing my PhD. I'm a PhD researcher at the Oulu University Business School. And that's something that I love to do. It's in research about health innovation networks. So that is also connected to this daily activities at the office. But then let's set the stage. In the earlier panel today, there were mentioned that this AI is of course coming and that quantum computing is coming. And yes, it will be the biggest change ever in technology in our history. So this quantum computing processing power, it's something that it can solve challenges and problems that we did not even know that existed. And the AI solutions previously, they were presented in a yearly basis, something significant. Now they are presenting something significant every week or even every day. So yes, we are in the merge of big change. But then how it is in the healthcare sector, the development is actually still on the linear curve. We are just piling paper on top of each other. If we think about, I'm now doing this comparison with this analog interface. If we think about linear development, it's something that we pile paper on top of each other, and then of course we increase the pile, but then it takes quite a lot of time. But what if it would be the exponential development curve? So if we want to make a 1 meter height of pile of papers, it takes actually 10,000 of these, 0.1 millimeter thick, and then A4 sized. But the exponential growth, it would be starting to fold the paper. Okay, one fold, A5 size, 0.2 millimeters. Now it's A6 size, 0.4 millimeters. Okay, that's not so impressive, but if I continue to make these folds, so what do you think, how many folds it takes to reach 1 kilometer height? If I could make the folds, or how many folds to reach the moon? Now you're thinking processors are scrolling, but I made the math for you. Only after 24 folds, we reach the 1 kilometer mark. Only after 42 folds, we reach the 480,000 kilometer, 384,000 kilometers, and that's more than the moon. So think about that. That is the exponential growth. And that is the key why healthcare sectors should collaborate with technology companies to bring these huge superpowers of quantum computing and other technology in the good use in healthcare sector. And how we do it in Oulu? We do it through ecosystem activity. We utilize Oulu Health ecosystem. There are the research and innovation resources from the University of Oulu, Technical Research Center of Finland. Then we have these health and social care providers, public healthcare like our organization, but also private healthcare providers. And then, of course, these several health and life science companies within the region. One of the maybe most recognition is Oura. You might know the Oura ring. The idea and innovation is from Oulu, nowadays run from the United States, but still the product development is located in Oulu. The ecosystem is run by Business Oulu. Minna Komu is here today as a network director. Jenni Konttila also doing great work there. And together we make these things happen and run this public-private collaboration. And let's not forget the citizens. They are at the center of the activity. All these efforts are provided for the better care for the citizens. And if we take a look at the map, Oulu is not the capital of Finland. We are actually quite remotely located. We are, from the European perspective, we are just in the periphery. But Oulu is just the right-sized city for the health technology development. And the collaboration between partners is easy. It's like natural, and we have this can-do attitude. And as a recognition to that, Oulu was actually ranked in the top 30 places for health tech startups in the world. There are places like San Francisco, Stockholm, Paris, and then Oulu. So quite proud of this achievement. And then let's move into this Oulu Health Labs topic. That is the innovation platform in healthcare operations where we can actually test solutions already in the development phase. I've been happy to hear these comments before that. Listen to end users. That was really well stated by you. And also, when we listen to end users, they can bring these, of course, usability feedback for the product development, but they can also bring in their ideas to be further refined and then created into these radical health innovations. Oulu Health Labs, in the concrete manners, it's ensemble of actors. Oulu's test lab in the university hospital, then primary care, social care and the elderly care by Pohde Wellbeing Lab, then future professionals by Oulu University Applied Sciences, and then world-class medical imaging training and testing resources from the MIT Lab. And together we can provide this opportunity for health companies, health tech companies, service companies to bring your idea to us or bring your prototype to us or even bring your ready product to us. So we will collect those healthcare professionals and refine and give feedback and make sure that this innovation can be refined further for the better results. Of course, it's the meeting of different worlds. There is different pace in the public healthcare traditionally, and then the startups companies with the really tight schedules and limited funding. So that is something where we need interface agents. Also, the language is not the same. We are actually speaking healthcare and the companies might be speaking health tech or technology. So there needs to be someone who is actually making these co-creation sessions happen and then follow the process and ensure that the communication is happening. One of the recent examples of our test cases is the MediCubex. It's the e-health station where the patient can actually measure all the vital signs needed for the basic health check by themselves. So this is an innovation that frees time from the healthcare professionals. And then when they meet the patient, they can actually focus on talking and meeting the patient and not just doing something on the computer and making the measurements. This is a really promising health tech startup in Finland, and we have been happy to be able to run this trial use of it in the acute reception of Oulu University Hospital. Actually, it was in the primary care of the Oulu. And then further, what is coming up? We see that robotics it's coming. We have been able to test those telepresence robots, social robots, and various logistics robots. What I would like to state here that these robots in the social interaction, you shouldn't put them down. Actually, when we have collected the feedback from the children and from the elderly, they are quite happy to be able to communicate with the social robot, because robots are always there for you, and they have all the time in the world to listen your topic, not just listening and then scrolling Instagram and YouTube and whatever. So that is something that has huge potential in the future. And then when we test something in the Oulu Health Labs, we can also provide feedback for the companies, and then for the best solutions that fill the criteria, we can provide them the Oulu Health Labs quality label. It's not the official standardization or something like a medical device regulation field, but that's the quality stamp evaluated by us. The other side of the story are the ideas from the healthcare professionals or from the citizens. We have an open channel continuously for these ideas. We collect ideas, we collect development needs from the professionals and from the citizens. And that's happened through the electronic idea management platform Orchidea. And the best of those needs that we recognize, we can actually take to the co-creation path. And this model of operation has been developed in the EU-funded in-demand project. It's been validated by the University of Oulu, and it's been tested in Finland, France, and Spain. And this, one of the examples here is the NE device developed Vitacam solution, which is the contactless respiratory rate monitor. The big thing here is that the need was real from the emergency room nurse. The technology company was not a medical device company before, but they evolved in the project. And the timeline from the need indication to the ready medical device, certified medical device, a little bit more than 2 years. So this is the revolution. This is different from the typical time frame of 5 to 7 years of developing a medical device. And this is something that we can do again. In the steps forward, we know that this AI is something that it's really hype at the moment. But also, we have been now reaching the technology readiness of these natural language processing models that can actually perform the tasks that we now want them to do. And like Veera presented yesterday, the great example from the Länsi-Uusimaa. So now a similar development is actually happening in Pohde with a little bit different technology solution and with our patient data management system provider, ESCO Systems. And also yesterday we talked a lot about biodesign. I'm happy to tell that Oulu is on board, and now it's the first round of biodesign that we have been involved, and great support from Aalto University in that. And that is something that is really good way of recognizing the real needs in the healthcare operation. And then only 2 words about the future hospital, but it's still something that I'm really proud of. It's the renewal project, 1.6 billion euro investment in total. Oulu University Hospital is being built, renewed and rebuilt on its current stand. And there, it's not a construction project only, but it's actually the way how we operate that's been renewed. And only then, when we know the new processes, we select the technologies needed and build the facilities that are needed for this new operation. And the D-Day for the start of the new hospital is on the 6th of November, so that's really soon. And there also we are utilizing the latest technologies in the infrastructure, like a first ever private 5G network in the operating hospital in Europe. This is something that is enabling a platform for the future health technology development. In here, we are utilizing it to run wearable solutions to bring better condensed information for the medical professionals. But it's open platform for further development, and would be happy to share more about that and discuss about that with you. And then one more, the last point is that Oyster is the future research development innovation center, which will be located next to the smartest hospital in the world. The first concrete part of the Oyster is this Oyster incubator, which has had a flying start, and I've been also happy to be part of the activities that they have been arranging. But there will be more, so keep in mind that Oyster is something that happens in Oulu. Running out of time, so not too much time for challenges. Only one. The big obstacle that we are facing is the cultural change that is needed. It's really easy to stick in the old habits. Technology that can be brought in, but if you're not changing the mode of operation, you are still stuck in the old habits. And there, I was happy to hear yesterday from Veera this be brave. So that is a really good way of starting this new path. Like I did something great last year. I did my first 100 miles trail run. So that was something that I did not know if it was possible, that I just took the first step and then continued on the path. So when you are developing something new, be brave, know where you're going, vision setting, target setting, that's crucial. And don't ever accept the first no. So with that, I could end my presentation. Thank you.
Thank you, Timo. And I know that you are in a hurry you have to catch a plane shortly. And unfortunately, you are not able to join our panel, but I will have 2 questions for you. You mentioned the cultural change, but
Yep.
how do you see, what are the most important key factors for increasing this collaboration through partnerships and innovation access to partnerships?
Good question. I think one of the key things is, it's been mentioned many times, but this demand-driven approach. So to know the real needs and then select the technology that can solve the need. So that's the way how we can actually speed up the process. Other thing is that this resourcing, it's a real challenge in public healthcare at the moment. Yesterday we talked with Saara. I don't know where Saara is, but there is a chance of applying these innovative procurement methods. We should, as a nation, we should use money for innovative procurement, and that is one way of solving this challenge. And also these research cases that we have been doing together with HUS, for example. So when we do great research and development application for EU level, so then we get decent resources for the development, and then we can also involve companies in those.
Yes, I agree. You mentioned innovative procurement, but how do you see, is it easy to find partners for your innovative projects?
In almost in every case, yes. It's been really, really easy. Of course, there are some limitations when we are operating for in real patient interface. So there needs to be these permissions in place, and then that might be the hindering thing. And also when we are discussing about AI development, so this model training with the real patient data, that is a challenge. So mostly the challenge is not about finding the technology partner, but it's about going through this hurdle of rules and regulations related to this privacy and security issues.
Great. Thank you once again, Timo, and I will let you go.